Hi, I'm Jack Fortner, Chairman of the San Juan County Commission. It's been quite some time since we felt that it was necessary to update you on the situation regarding the COVID-19 pandemic in the Four Corners area. But as the holidays are approaching and the governor has enacted more restrictions, well, together the Farmington Mayor Nate Duckett and the San Juan Regional Medical Center President and CEO Jeff Bourgeois, they're both joining us so that we can address you. And I want to thank you both, Mr. Mayor and Mr. Bourgeois.
My pleasure.
Sir. In recent days, we have watched the numbers skyrocket as New Mexicans are suffering with COVID-19 and some are dying. Now, there are more closures that will change our daily lives, as the governor announced today. It will be especially difficult as the holidays typically bring families together. So I encourage you to be smart this season. Use the phone, use video conferencing to protect yourself and your families. The fight against the coronavirus is long and difficult, as we've seen now by experience. But we must take heart, be strong, continue to fight the fight. And it isn't just for us, it's a fight to protect those most at risk in our world, from senior citizens to the elderly. But our world has been shaken. Nothing is what it once was. Right now, so many are mentally suffering. And if you need someone to talk to, I encourage you to seek those resources, and I encourage you to please check on your friends and your neighbors and make sure that they're doing okay. Terry and I are praying for you, those who are sick, those who have sick family and friends, those who have lost loved ones. We're praying for strength and healing every day. Now, I want to talk about the situation here in San Juan County, and specifically at San Juan Regional Medical Center. Jeff Bourgeois.
Thank you, Jack. Today I'll be sharing some statistics and updates from our current situation as of Friday morning, November 13th. As Jack mentioned, within the county and the state, we've seen a sharp increase in the number of COVID-19 positive cases. Hospitalizations have risen significantly across the state, as well as here at our hospital. I'll show you some of our current numbers here in just a minute or two. As Jack mentioned, I want to reemphasize something that you're going to hear more than once during this presentation, but that's to protect yourself and those around you. We really want to emphasize the importance of COVID-safe practices. Wear a mask, wash your hands, and practice social distancing. We've heard these requests and steps before. Please be an example, and following them can really, truly help to make a big impact. We also encourage you to stay informed via our website at sanjuanregional.com, where we've set up a COVID-19 portal specifically to help our community stay informed. So let's get to those statistics. Our total inpatient census this morning was 166. Our COVID positive confirmed cases were 40, with another 4 patients under investigation awaiting test results. We have a total of 4 intubated patients, 2 of those being intubated patients at the time. The slide that we're sharing now shows the trend line. The top blue line is our total inpatient census. The red line is those patients pending. At the very bottom of the red line shows the total patients pending test results. There's a green line that's almost right on top of the purple line, and the green line is total positive COVID-19 patients, and the purple line is the combined sum of those two. What's important to note is that that purple line is now just over 40 as of this morning, again, Friday, November 13th. That exactly doubles where we were just a few short days ago on November 2nd. So a sharp increase in hospitalizations here at San Juan Regional Medical Center is consistent with what the state is seeing. The statewide hospitalization number was at 471 this morning. This next slide shows a 14 and 17-day rolling average of our positivity rate for tests taken specifically at the hospital. The red line is the 14-day rolling average, and the green line is the 7-day rolling average. You'll note a slight downward trend on both of those on the far right-hand side of the graph. I ask you not to read too much into those. There's incomplete data for the more recent days, as we have a number of days that are still awaiting completed test results. But what is important to take away from this slide is that we are now approaching levels of positivity rates that we saw back in mid-May at the peak of the first wave of this pandemic. So we are still on the upward swing, and what's important to note is that hospitalizations lag the positivity rate. So we anticipate a higher rate of hospitalization here at our hospital in the weeks ahead. In an effort to keep everyone safe, we've made the painful decision to reenact our visitor restrictions, which is a no visitor policy, save for very few exceptions. This purpose is pure and simple to keep everyone safe. Exceptions to this policy will be made on a case-by-case basis and are limited to the following: parents or legal guardians of minors, visitors for patients who lack decision-making capacity, visitors for patients at end-of-life circumstances, and then finally, visitors for the expected mother during the duration of her hospitalization. Within these exceptions, visits are limited to one person per day per patient, and visitors will be screened prior to any visit, much like you've experienced recently if you visited the hospital, with a temperature check and a few questions to answer. These visitor restrictions include not only our main hospital campus, but also all of our outpatient service locations. Any exceptions will be made in conjunction with the provider, case manager, or the bedside nurse. We understand the difficulty that this imposes on family members who wish very much to visit their hospitalized family member or loved one. We don't make this decision lightly, and we feel that we've held off as long as we can on going back to this level of restriction, as many other hospitals in the state moved back earlier in the month, or maybe even as far back as October. So in closing, please remember why we use COVID-safe practices. Things, again, such as hand washing, social distancing, and wearing a mask. Ask that you think about who you do it for. Maybe it's a grandparent, a child, a friend, or a neighbor. Remembering your why will hopefully encourage each of us to use COVID-safe practices. Please take care of yourself and each other. Your health is your most valuable asset. We are in this together. Together we can make a difference. Together we will get through this and succeed. Thank you for allowing me time today, Jack, to share this with our community.
Thank you. That was Jeff Bourgeois, the president and CEO of our hospital, San Juan Regional. Now I'd like to welcome my good friend, Farmington Mayor Nate Duckett. Mayor?
Chairman Fortner, Mr. Bourgeois, thank you both for the opportunity to join you on this community update. We've just had the governor provide us her most recent update to the public health order, and I just want to reaffirm to our community the need to support San Juan Regional Medical Center, support our local assisted living facilities, support our EMTs, firefighters, first responders, our nurses, the doctors, Indian Health Services. These are the finite resources that we have available to us, no matter what it is that you may be sick with, whether it's COVID, maybe it's cancer, maybe you have a heart attack. These individuals that are trained professionals to make sure that you get the best care possible, they're taxed right now. They're taxed to the max. That is the biggest concern that I have regarding where we're currently sitting, because we have not reached the point of maxing out here in San Juan County as far as availability of beds and respirators and those things. But as I understand it now, Albuquerque is sending patients our way, which was not the way it was initially designed. So things have changed here over the past 6 to 8 weeks. And I think if you're reading the tea leaves, if you're paying attention to the numbers, which are posted every day on a number of different media sites, this shouldn't have come as any surprise to anyone, the update to the public health order that we saw. There's a lot of anxiety that this community feels when it comes to Thursday and Friday every week as to what is going to happen. But we shouldn't be surprised by this type of activity, noting the big change in the number of the positive cases, hospitalizations, and what I hope is not the case, maybe a 2-week delay or more, where we might see deaths rise again here in our state. We don't want to see that. But most importantly, we want to make sure that we have those individuals who are trained and ready to serve this community and its healthcare needs, able to handle that. And my heart and my prayers go out to them, because I realize that they're stressed out right now. So I want you all to know that we're praying for you, and we're doing our best to try and provide the resources. I know Jeff is, and Jack as well, to support you in this moment. But where do we go from now? And I think that's the question that many people have, because people are frustrated. Obviously, people don't want to see people sick, and they don't want to see people with long-term health implications because of COVID, but people also don't want to see businesses closed. And so it's that balance that we're trying to strike. And unfortunately, in the situation that we're at now, this is the strategy the state has taken. This is the game and the rules that we have been given. And I think we need to embrace the moment and recognize that we have an opportunity here, as Chairman Fortner and Mr. Bourgeois noted, to work together for the benefit of everybody here. And that's the critical thing going forward. I'm frustrated, but that doesn't matter. It's the time of giving. It's been the time of giving for the last 8 months, but even more so now as we get into the colder months and move into the holidays. Let's make that a priority for us moving forward. Let's look for opportunities where we can provide hope, where we can provide food, where we can provide assistance to those in need. And there's lots of places out there to do that. The city of Farmington is going to continue to look for opportunities to provide CARES Act funding, as I know the county will, for rent and for child care and for those types of needs, for food, because it's going to be more important now than ever. And I think I've used that phrase quite a bit in my discussions regarding COVID. Every time it seems that we come to this point, it's more important now than ever that we truly support one another, and that's what our community is built on. So the next part is taking care of yourself. You need to take care of yourself. There's too much opportunity here to allow your feelings and emotions to overcome what is around you and the resources that are available to you to support you. Make sure you are taking the time to exercise. Make sure you're taking the time to talk to friends and family about things that you may be feeling. And know that there's other resources out there available to you through the 211 United Way helpline for other things that you may be needing. So know that this community is supporting each other right now, and take advantage of that as you need to. But this is where we're at, gentlemen. This community has sacrificed a lot. She has laid out a plan where it will be a county-by-county reopening, which is new, which tells me that there is an opportunity here in San Juan County where we have done a great job, where businesses have been putting forward great COVID-safe practices, and we've seen that on the rapid response list. Very few of our businesses have been listed there, but that tells me that there is opportunity for us. It doesn't have to just be a statewide reopening. If in 2 weeks we can see the numbers here in San Juan County improve, there is a possibility that we could be reopened sooner. And I think that's something that's worth striving for. So, Chairman Fortner, thank you for this opportunity. Mr. Bourgeois, thank you for this update. And to everybody out there, keep your head up. That's all we can do. This is the time of year of holidays and giving, and my thoughts are with you and all of your families. Thank you.
Thank you, Mayor Duckett, and thank you, Jeff Bourgeois. It's clear the fight isn't over yet, but together we can hold on and stay 6 feet apart, stay well, stay safe. I've said it before, it's not a political issue, it's a health issue. Wear a mask, be safe, let's get our county back open in 2 weeks. I'm Jack Fortner, Chairman of the San Juan County Commission. Thank you.